30 new COVID-19 cases confirmed today, with one in the community.
The other 29 were imported and placed on stay-home notices or isolated when they arrived in Singapore. The Health Ministry will share more details tonight.
Despite vaccines being rolled out around the world right now, the fight against COVID-19 is far from over.
And for some patients, they may continue to show symptoms months after being infected with the virus.
Published in the Lancet journal last week, a study of around 1,700 patients from a Wuhan hospital found that 3 out of 4 patients still suffered from at least one symptom 6 months after contracting COVID-19. And the most common problem, fatigue or muscle weakness.
Dr. Ashok Kurup, who chairs the Academy of Medicine's chapter of infectious diseases physicians, said doctors in Singapore are seeing some patients who have recovered from COVID-19 but are having respiratory issues.
Well, Dr. Kurup joins us now to share more. Welcome, Doc. So, besides what you've told Salma, are there any other observations seen in cases here that are particularly worrying to you?
Well, to be honest, not at the moment. I think that our numbers, fortunately, of very sick individuals, etc., were not very high at the outset. But we are seeing patients who come back from the region. So we have patients who have fallen sick and they've been quite sick in the region, and when they recover and they want to seek treatment, they come back here. And we have seen that a lot of them actually have problems with the respiratory tract by way of decreased lung capacity and so on. So this is the most common manifestation that we've been seeing, but we could be seeing a skew because these are the people who have the intent of seeking medical care. That means they are sick enough to come across all the COVID restrictions to come and seek medical care over here. So the people over here itself, our own cohort of patients who fell sick, I think that the National Center for Infectious Diseases, they are also following them up, and they will also be publishing their data soon. But I think that from my discussions with them, they are not seeing a huge proportion of them with so-called long COVID manifestation. And from what I gather from my colleagues, nothing very serious either.
Doctor, perhaps it's worth to recap what happens to the respiratory system when a person contracts COVID-19, and how does it lead to long-term damage?
So when someone gets COVID-19 infection, the infection actually damages the air sacs and the linings of the air sacs in your lungs. So what happens is that, at the same time, the body fights back. And when it fights back, there is a lot of fluid that accumulates in the air sacs and the lung as a whole. So there is a lot of damage, and this acute injury can become worse, and the person might need oxygen. And they could end up being in the mechanical ventilation complication. And we see so many of that happening around the world at the moment, even now. And when they recover from that, it's not such an easy, process, because a lot of them had so much damage to the lungs that the lungs and the tissues become very scarred down. So that's reduced lung capacity, and the lung cannot function as it was before baseline. It's not the same as going back to a normal state. And the lung may not be able to take in as much oxygen as one could have. So in persons who are elderly and they already have maybe some cardiac condition, and on top of that, they have this lung problem, then that's going to make a lot of conditions worse for these individuals. And that is one of the sort of main concerns that we have when we discuss the long-term health consequences of persons who are critically ill with COVID, and their subsequent recovery process can be thwarted by such complications.
Symptoms mentioned in the study include fatigue or muscle weakness, as well as sleep difficulties and anxiety or depression. But these can be a result of other illnesses. So let's say
totally.
So if I'm a recovered COVID-19 patient and displaying these symptoms, can I link these ailments directly to COVID-19, or is it jumping the gun a little bit?
No, that is a very good question, and that continues to perplex a lot of investigators and researchers the world over. In the US, we have heard that it is very difficult because the symptoms, as you as you rightly pointed out, are quite nebulous, and they can be sort of, any other kind of infection or illness. And to be honest, there are many different kinds of viruses or some specific bacterial conditions that can do the same thing. For example, a bad case of influenza or some viruses like adenoviruses and so on. When they make a person sick, they can do some collateral damage, and that individual can continue to suffer in the aftermath. So it's not so easy to boil this all down. And also the other problem is the issue about infodemic. Maybe, there is a lot of media attention on a lot of these concerns that people bring up. So is it a real phenomenon, or are people overlooking, or not overlooking, but maybe looking too much or reading too much into the symptoms?
On one hand, it's about planning and looking into these cases even more closely. But let's talk about the long-term effects. What is the medical community doing about these long-term effects? Are they treatable?
So we treat a lot of the complications depending on what kind of severity they have. So, for example, the lung concerns that we just spoke about, or some of them can have cardiovascular conditions or conditions affecting the heart. And so what happens is that, of course, there are different specialists who need to be involved. Like, for example, when it comes to the lung, there's a lung specialist. When it's a heart, then it's a cardiologist. Some patients might have what they call the brain fog, or some kind of vague neurological symptoms, and you might need the neurologist for that, and sleep difficulties. And so what we are trying to say is that, you see, firstly, as the medical community at large, we need to firstly find out for ourselves what is the problem that we have, especially locally in our setting. So number one, we have to figure that out. So we have to have a system in following up certain individuals who we think might end up having complications, and therefore follow them up. That's number one. Number two, we do need to have a multidisciplinary kind of an approach, one that is integrated, so that there can be a rational approach to the research agenda as well, which can then inform appropriate therapeutics, which can answer the question that you posed, whether or not such individuals would benefit from certain kinds of interventions or not. Mm-hmm. So it is a kind of a research agenda. It is a kind of a process that we all need to work together to kind of do this in a very seamless way. Otherwise, there'll be a lot of disintegration of services. People might be seeing one specialist jumping to the other and doctor hopping, and that is not going to help anyone, least of all the patient.